All right, thanks, guys. Doug Drysdale, as promised, the CEO of Cybin Incorporated, back with us once again on the show to give us an update on the company and its work in the medical psychedelic field. I want to start, Doug. Good to see you, by the way. Thanks for doing this once again. I want to start with a little look at the move to the NYSE American Exchange in the U.S. So CYBN, guys, the ticker on the, again, NYSE American Exchange. Tell us about the uplisting going back to August here. It was just back in August when this happened. What does that mean for the company?
Yeah, hi, Brendan. Good to see you again. Yes, you're right. So Cybin is the first psychedelics company to be listed on the NYSE American under the symbol CYBN. And we've seen tremendous uplift in volume and liquidity as we move to that exchange. I think really opening up the stock to retail investors.
So when we look at what this means overall on a scale of more institutional attention, more institutional money obviously coming in, and exposure for this work that the company continues to do, how do we see that benefiting going forward into not only the remainder of this year, but maybe into next year?
Yeah, I think this extra liquidity obviously provides us greater access to retail and to institutional investors to fund our drug development programs. And we have 3 lead programs that are designed to deliver faster onset, shorter acting treatments that could be more easily adopted by depression clinics and addiction clinics.
We got positive preclinical data on or from some of those trials in the second half of this year. Before we get into the treatment itself and what that means for the company, let's talk a little bit about how this treatment, for somebody who's maybe not familiar with the psychedelic drug treatment, talk about the process here and how it may be compared to going to a traditional doctor and getting something along the lines of, a prescription, as most people have done before.
Yeah, these treatments are a little different in that they're given under supervision in a clinic, and they're integrated with psychotherapy. So Cybin has developed its own proprietary psychotherapy program called Embark. Patients receive therapy before, during, and after their treatment. And it's really the combination of the psychedelic molecule and the psychotherapy that delivers these impressive results that we've seen in many academic studies now.
So when it comes to the preclinical data, as we said, give us an update, I guess, on where this trial is to date and where we see maybe things progressing as we move forward here.
Yeah, so we recently received approval to run a phase 2 study on our lead program, which is a sublingual film formulation of psilocybin. And we expect data to come from that study around the end of this year. And that'll show us whether we're able to really deliver that fast onset and shorter duration that we're targeting.
So there's a new partnership that we can happily talk about as well. Give us an update on the addition of, and I want to get this right, 129 additional depression clinics in the U.S. Tell us about that.
Yeah, infrastructure is important as we start to run these clinical studies. With all of that psychotherapy and all of that supervision, you need clinics and therapists to support those. So Cybin has partnered with Greenbrook TMS. They have, as you say, 129 depression clinics across the United States. And that partnership allows Cybin access to infrastructure to support clinical trials with multiple psychedelic drugs over the next several years.
Cybin.com, guys, CYBIN.com, if you want more information. Again, listed here in Toronto as well as on the NYSE American Exchange in the U.S. Under the ticker CYBN. Doug Drysdale, it's always a pleasure. Thanks for doing this.
Thanks, Brendan. Take care.
There we go, guys. Cybin Incorporated. Again, CYBN, the ticker.